comes to teaching strategies, it's important to think about the ways to actively engage students in their learning. By incorporating activities that lead to self-questioning, problem solving, and deeper thinking, students can more easily process and retain information. But how do you transition your active learning strategies from a face-to-face course to remote delivery? Dr. Caroline Porr, Associate Professor in the Faculty of Nursing, has been considering this very question. In her first-year therapeutic relations course, she's relying on the same active engagement principles she's used in her classroom, but adapting them to our remote environment. Among other strategies, Dr. Porr plans to maintain virtual face-to-face interactions as much as possible and facilitate virtual role play to simulate nurse-to-patient care. But most importantly, she plans to be attentive to students' personal well-being and acknowledges the additional stressors that come with learning to be a nurse during a pandemic.
I completed my doctorate in public health nursing at the University of Alberta, and then I came to beautiful Newfoundland Labrador in 2010. And I have been teaching in the undergraduate and graduate programs here in the Faculty of Nursing ever since. And I became an associate professor and really immersed myself in the online distance program, which is the master's level graduate course, and also in the face-to-face PhD program teaching. When the pandemic, March 11th, was announced and restrictions were in place, and by March 23rd, Memorial had decided that there would be no face-to-face classroom, then we all buckled down and started to strategize what would remote delivery look like for the undergraduate students who predominantly have relied definitely on the face-to-face classroom, lab, seminar, lab instruction, and clinical practica. It became apparent that I'm not expected to design an online distance course, but I am expected to take the course classroom environment to the virtual platform. I have been looking at how do we engage students? What will that look like during a pandemic? How do we keep the students safe? How do we keep them comfortable with the virtual sharing? What if they don't have the technology, that bandwidth? What if they have some fears about coming online and putting their face up on the webcam and sharing with their peers? But thinking about how to ensure that students do feel safe, that we have fun, that we are very personable, and that I'm present with the students. And I think there's going to be lots of opportunity for that. I think the face-to-face with all these students and calling on them and talking with them in a very personal way and responding to them, I think that's going to be very engaging, actually. In the fall now, the remote teaching and learning delivery that I'm preparing for, it's a course about engaging students in the skill and knowledge and competence to be able to develop a therapeutic relationship with their patients, with their family members, with their clients. So the course is structured where there are the traditional classroom lectures twice a week, and then there's a lab component as well. So they're going to take the concepts that we engage in during the classroom, the virtual classroom, and I will do as much as I can to engage them in small group exercises virtually. But in the lab, they will have smaller groups, 8, 9, or 10, which would be broken up into the online rooms of even smaller, 2, 3, or 4 students. And so they are going to learn these concepts by living those concepts, actualizing those concepts, putting them into practice, because you can't learn how to develop relationship by reading a textbook or sitting in a classroom. There really needs to be that engagement and activity. So the students, one of the assignments that they've done in the past is the videotaped simulated interaction. So in pairs, they would simulate a nurse and a patient, and they will be able to do the same now virtually. In Brightspace, we have the technology so that 2 students can actually go up on the screen and be side by side and have a conversation. They can actually interact. So the student who plays the nurse would introduce himself to the other student or herself to the other student who is portraying the patient. They would problem solve a particular health concern that the patient raises. And the nurse would be expected to engage with that patient in such a way that the patient elicits his or her story, the patient shares concerns, the patient expresses feelings, and it's the response of the nurse that fosters that ability of the patient to share what's really on the mind and in the heart. So there are techniques, there are verbal techniques, and there are nonverbal techniques. So we will definitely be relying on the facial expressions throughout this videotaped interaction. Another thing that the lab will facilitate is the opportunity for students to be somewhat more intimate with one another, in that they will be able to share more safely in their smaller groups. The lab groups, the students come to know each other very well, and if we can foster those norms of it being a safe place, starting each lab with a talking circle. This is something the Indigenous peoples practice, is the opportunity for each person in a circle to share from the heart, and that there's no interruption. And we've been practicing that with our lab groups. So that's one of the things that we can do virtually. Again, in the small sort of foundation subgroups of the lab, students can carry out the talking circle and each one share maybe some recent anxiety, or share a positive note, or maybe something that they've been able to overcome. I'm looking forward to the opportunities, but feeling that angst about, am I going to be prepared? But we're all in this together, and there will be glitches. And if I can keep a sense of humor about that and say, you know, students, we're all in this together. I'm not perfect. I don't know what we're going to do now, but let's all take a coffee break and come back in 10 minutes and I'll figure this out. So I'm hoping to take one technological step at a time. The direct involvement of some of the graduate nurses who were working with COVID-19 patients, that was quite heart-wrenching for me. And you know, the stories that we've seen in the news, well, you know, a student sharing how she in particular was this loved one's family member. There were restrictions. The family could not visit with their dying father, husband. She was the last person that this dying person saw, the last gloved hand that was held, the last covered, screened face with the mask that this patient encountered before his last breath. So these were heart-wrenching, and again, just invigorated and incited in me that passion for the nursing profession. I really think it is privileged intimacy with strangers, and it really came to the forefront throughout this pandemic. The frontline nurses have been working hard, and I can attest to that in some of the stories from these graduate students. Absolutely. As nurse educators, I may not be in the frontline practice environment at this moment, but my practice is with the students. So I want to role model caring. And so caring for the student, very much like caring for a patient, you want to be there and present and an active listener. Be able to excite that student about learning, be able to address areas for improvement, and do that in such a way that the student wants to do better, wants to live up to the course expectations, wants to advance understanding. So all of that strategizing and how you do that and do that well, I find that very very challenging on one hand, but very satisfying. And I love that about teaching and learning. So I think in a nutshell, I value when students say they got something out of this course, they got something out of this lab, they got something out of their time and effort. They're busy. They've got a lot on their plate. And if I can bring them to that table of learning and provide them with opportunities, then I value that time spent with them because they found it beneficial for their learning.